Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then what is a there is something called as hibernating myocardium. Okay, this hibernating myocardium is because of there are some in here there is left ventricular dysfunction occurs. But why? First, there are some non-contractile or there are some hypocontractile segments. There are some non-contractile or hypocontractile segments are present. These non-contractile and hypocontractile segments are viable. They are viable, but they are viable and they are also ischemic. They are chronically ischemic and they are viable also. So because these non-contractile and hypocontractile elements are viable and they are chronically ischemic, so these are ischemic, so they are not receiving the blood supply. So as a result, this will result in left ventricular dysfunction, but actually they are in reality viable. They are alive, but they are not receiving blood supply. So these myocardium are called as hibernating myocardium. Because of this left ventricular dysfunction, they will also have reduced. There is here why. Okay, why does these occurs? Then what is the reason for these hibernating myocardium? This is because there is actually chronic reduction in myocardial blood flow. Whenever there is chronic reduction in myocardial blood flow, these segments down regulate. So these segments which are there, these segments will by themselves, they wanted to protect themselves from the ischemia. So as a result, these segments will down regulate their contractile function. They will down regulate their contractile function. So these elements will downregulate their contractile functions by themselves. So the main treatment of this issue is you will have to revascularize the patient. Revascularization by itself, it will improve the myocardial blood flow, and once the myocardial blood flow is improved, this segment will return back to its function and thus it improves its survival. Okay, so this is hibernating myocardium.
thank you and thank you for watching.